All right, well, welcome to ISSOP's ongoing seminar series on climate change and mitigating the impact of climate change on children. My name is Jeff Goldhagen. I'm a pediatrician with the University of Florida and have had the privilege over the last couple years now of being president of the International Society for Social Pediatrics and Child Health. And for those of you who are not familiar with our organization, we're the only global pediatric organization focused on social pediatrics with a firm grounding in a child rights-based approach to all that we do. We have focused on a number of issues over the past several years, one of which is children on the move, another focused on the impact of armed conflict on children. And these initiatives are still going. And this year we have launched a sustained focus on mitigating the impact of global climate change on children. So this is one of a number of seminars that we've had, and we're really excited to have two wonderful presenters, experienced and knowledgeable presenters for us today that Ruth Etzel will be introducing. I need to thank Miguel Perez, who helped support our IT, and Eva Goldhagen, who is managing this series. Without their help, we would certainly not be able to make this happen. For those of you who have not been with us in the past, we have recorded all of our sessions, which is on our YouTube channel. So you can just go to YouTube, search for ISSOP, and you'll find all of the previous presentations, which have been superb. Every one of them has been really, really excellent. The format for the program for the session will be a brief introduction, which I've already overcome the briefness of that. Then we'll be introducing our speakers. But important, after the session, we will break out into breakout rooms based on primarily regional breakout rooms. And we really encourage everyone to participate in those rooms, in particular because we record them and we'll be collating the themes that result from those breakout sessions so that we have the ability to really create a strategic approach to what we'll be doing in the future based on what we've learned from the speakers as well as from the breakout rooms. It would be inappropriate for me not to end with a shameless advertisement that we would love for all of you to join ISSOP, and you can reach us at issop.org, ISSOP.org. We have gone to a donation-based membership, so you can join free of charge, and we ask you just to consider making a donation, whatever donation you can, to the organization. We're making a significant impact around the world, and we need your voice and your knowledge and expertise and your passion to amplify what we do. Having said that, let me introduce Ruth Etzel, who's a close friend and colleague for many years. She gets a little bit embarrassed when I say that Ruth unquestionably is the mother of environmental pediatrics here in the United States, has made a huge impact here, has worked globally, not the least of which has been with WHO in really introducing and advancing the issues and concerns related to environmental health as it relates to children. So I'm going to thank Ruth for a lifetime of work and a lifetime of partnership and collaboration, and turn it over to her. And again, thank you for joining us.
Thank you, Jeff, and good morning, good afternoon, and good evening to our attendees. We're so glad to have you here. It's my pleasure to introduce our two distinguished speakers. First, we'll hear from Professor Edda Weimann, who is a pediatrician, an endocrinologist, and a public health specialist. She earned her medical degree at the Ludwig Maximilian University in Munich, her pediatrics training at the Goethe University in Frankfurt, and her master's degree in public health at the University of Cape Town in South Africa. She did her postgraduate research at INSERM, the National Research Institute in France. Professor Weimann is a faculty member of universities in Germany, in Switzerland, and also in South Africa. And currently, she's the medical director of a children's hospital for chronic diseases in southern Bavaria. She's published over 70 articles in international peer-reviewed journals, and she's also published 2 hospital management books, the most recent of which was titled High Performance in Hospital Management, a guideline for developing and developed countries. The second edition of this book was published in September of 2021, and will also discuss the implications of climate change as well as sustainable development in the provision of health services. Our second distinguished speaker is Catriona Mellor. Catriona is a child and adolescent psychiatrist working in the adolescent inpatient environment. She trained with the National Academy in Eco-Psychology and Nature-Based Practice. She's a member of the Royal College of Psychiatrists Sustainability Committee and currently working with the college and the child and adolescent faculty in their response to the climate ecological emergency. Dr. Mellor works directly with children and adolescents to understand and to support their mental health needs during the climate crisis. She focuses on raising awareness and developing training and resources around eco-anxiety, climate grief, and related experiences. And she's also working to bring nature into the center of the health response to the climate emergency. Welcome to both of our distinguished speakers, and we'll start off with Dr. Weimann's talk. Miguel, would you cue Dr. Weimann's talk?
Hello and good day. My name is Edda Weimann. It's an honor and privilege to give you a very brief overview about the implications of climate change on child health. So first of all, I would like to state the current status quo, where we are now. So in a way, we have moved on from climate change to a climate crisis where we are in now. And there's a high possibility that we are going to experience a climate breakdown. So what does that mean for us and what does it mean for our health? By definition, climate change causes the heating up of the planet, the acidification of the oceans, and the increase of water temperature, the melting of glaciers, and triggered by these aspects, also the mass extinction of numerous animals, plant species, and of us, humans. And since climate change threatens every living being on Earth, we speak of a climate emergency. It's also important to note that we have to stay within our planetary boundaries that are also defined by the 9 active tipping points and by our diminishing CO2 budget that lasts up probably about 8 to 10 years max. Just also looking at global warming and tipping points, as mentioned before, they are all active. Some have already tipped, such as the Arctic sea ice and the West Antarctic ice sheet. But there are also other highly endangered habitats like the Amazon rainforest, in a way that serves as the lung of the earth to keep us alive. It's also important that we stay well below 2 degrees temperature increase, just to avoid a point of no return. So just what are the current data? and the current facts. So we are currently have already experienced 1.1 degree of global warming. The Paris Agreement stated that we have to stay below 2 degrees, optimal at plus 1.5 degrees. But if we continue like now with the current climate policy, we will end up by an increase of 2.9 degrees temperature increase, what would mean for all of us that we are going to face an uninhabitable Earth in the very near future. Just looking how climate change impacts health, there are various implications. We experience more droughts, freshwater shortages. We're also seeing more extreme weather events, a changing distribution of infectious diseases, displacement of people, and definitely also compromised food security. We have more temperature-related illnesses and deaths, an increase in waterborne illnesses, a spread of infectious diseases and vector diseases, more injuries and illnesses related to extreme weather events, and a wide range that impacts us from air pollutants. What are the implications for countries, for populations? The low and middle income countries are at the highest risk for environmental diseases, but also for climate-related diseases. The children under 5 and are also more prone for climate vulnerability, and calculated by the WHO, this causes 1.7 million deaths only in children. So moving on to this well-known figure by the Lancet Commission, it gives an overview of the links between greenhouse gas emissions, climate change, and health. And I would like to focus on the climate change related health risk that are highlighted here at the bottom. So I'm going to elaborate on heat waves, on air pollution and asthma, on obesity, and on diabetes. So this is the current situation here in Europe, here especially here in Germany. So in a way, as every year, the heat is on. So as you can see, we are experiencing for 1 week now quite hot temperatures, about around 35, 37 degrees, just to give you, familiarize you with degrees, also giving you some indication in Fahrenheit. It should be very uncommon for Germany in general, but also for this time of the year. And that also brings us to the definition of a heat wave. So a heat wave is defined as an extended period of hot weather related to, relative to the expected condition of the area at that time of year, which may be accompanied by high humidity, what we can also see and experience right now. So we had very severe heat wave in 2003, causing 70,000 deaths in Europe. And well, every year it's getting hotter and hotter. We are just breaking, every year we are breaking a new record. And you should expect that there are some precaution and plans in place to protect the public against heat, and you may find advices for adults, but very little on children. And what I found was, well, I found it a bit sad, but also amusing that you should ensure before you leave your car that you do not forget children or pets. So in a way, children are almost on the same level as pets, and we as pediatricians must put that in the right direction and correct it. So looking into publications regarding heat waves and children, there are more and more publications also dealing with children, but most of the publications are focusing mainly on adults. But there's an increase of heat-related morbidity and mortality seen. The authors also asked for response plans for extreme heat events and in a way also heat preparedness. In addition, it needs to be noted that the population of the global south are more vulnerable, as well as people from a poor socioeconomic background. We can see more hospitalizations of diabetic patients and also premature deaths, and also patients with renal diseases, respiratory diseases, and fever are at higher risk, and this should be noted and known by health professionals. Another relation is the trauma related to heat exposure, and that's also observable worldwide. We have experienced and seen it in Australia last year, California. Well, it appears in a way every year, and Southern Africa in Cape Town. The upper picture just is a picture of Table Mountain, photo of Table Mountain, of one of the wildfires that are quite common there. And there was also another huge wildfire in Cape Town just a couple of weeks ago, affecting the university hospital and the university. Moving on to air pollution, that's also quite an important topic, especially for children. In Europe, with Clean Air Act, so-called Clean Air Act, we still have 450,000 people that die caused by air pollution. And we can also see it in other countries regarding air pollution and death. For example, areas that are highly polluted are China, with a lot of coal-fired plants, India, also many coal-fired plants, and highly polluted Pakistan, also resulting in over 5 million deaths. Worldwide, there are 7 to 8 million deaths attributed to air pollution. And interestingly, air pollution does not only affect the respiratory system, but also causes stroke and heart disease and mental illnesses. There are also publications dealing with it. So there's a new publication highlighting the effects of air pollution on infants and children, respiratory mortality in 4 large Latin American cities. Also, pollution is related to and higher in urban areas, and air pollution is and has an important impact on children as well as on infant mortality. In addition, particular matter, ozone, sulfur dioxide, and nitrogen oxide are associated with respiratory deaths in infants and children, and policy needs to be implemented and enforced to prevent adverse health effects in children. In PLOS1, there's another study published on the interlinkedness and effect of outdoor air pollution on asthma exacerbation in children and adults, and looking into that. Beginning of the year, there was also quite a prominent court case in London highlighting the interlinkedness and interrelation between air pollution, child health, and death. There was another case in Paris last year, and that might give some hope that politicians also now clean up the air of cities for the sake and health of children. This was also highlighted in the British Medical Journal just a couple of weeks ago, entitled "Control Pollution, Protect Children and Save Lives." There's another, not only the COVID pandemic, but there's another pandemic, the obesity pandemic. Also, obesity is increasing over the last years, also in children and adolescents. And interestingly, there are also now publications highlighting that the obesity rate will increase with climate change and also contribute to a higher burden of non-communicable diseases and also a higher impact of health expenditures. For health expenditures related to that is a more sedentary lifestyle with hotter temperatures. For example, when it's becoming too hot, people and also children stay indoors, are less active, and just eat more, game more, and watch more television. And also, this also results in an increased BMI. And this is also a graph showing that there is an ideal temperature to stay in a way lean, and higher and lower temperatures, outdoor temperatures, are related to increased body weight. This is also summarized by the Lancet as a global syndemic of obesity, undernutrition, and climate change in the Lancet Commission report. Yeah, what's happening in the field of diabetes? As we know, that's also another pandemic. The rate of incidence of diabetes is increasing, and it's not surprising, for example, that also temperature increase by 5% increases hospital admission of diabetic patients by 6%. By 6%, also air pollution leads to an increased diabetes prevalence, also damaging the beta cells. The one underlying reason is also that heat waves reduces physical activity, as stated before, of children, and this results in a diminished glycemic control. What you can also experience, that also heat influence insulin medication, and if you have ever worked in hotter areas, in hotter countries, in a hotter climate, you can imagine that this will, and the hotter climate will influence insulin medication and stability as well. There's another study published from South Africa exploring whole hospital admissions for various diseases, and the authors could show an association between temperatures, air pollution, and hospital admission for climate-sensitive diseases. They also have notified an increased prevalence of pneumonia-related admissions that follow changes in air quality after time periods of 10 to 15 days. And there were increased admission for malaria following the co-occurrence of high temperature and rainfall after a 30-day interval. And these findings have relevance for the implementation of early warning systems and for climate change adaptation plans to protect human health and child health. Yeah, with aggravation of climate change, we experience more extreme weather events like storms and more water scarcity, more droughts, and that also results in more hospital admission and more emergency cases. So what we can learn from all these findings and what can be related to public health. There are also publications highlighting their co-benefits of an improved global climate policy. So a better climate policy and more stringent climate policy would have positive results for our health, for our global health, but also for health expenditures. And this was also pointed out by the Lancet Commission some time ago, that we need urgent policy responses to protect public health. Well, to summarize the findings, there are also some action points for us. So we all need to push for a reduction of local and global air pollution. We need to establish green spaces and also respecting the natural habitat. And that's one major lesson that could and should be learned from the COVID pandemic. We should enable regular outdoor activities, but you can only enable what's still there. So if there's no nature and greenery around, there won't be regular outdoor activities possible. So we need to fight for that. And then there's also one point also with the upcoming COP in Glasgow in Scotland to enforcing the Paris Agreement and really stay within the 1.5 degrees temperature increase. So to conclude, climate change has huge adverse effects on the health of children. And the health of children is yet not in the focus of policymakers and politicians, mainly because also children don't vote and are not voters and probably are not in the main and major interest of politicians. An increase in asthma, obesity, and diabetes are seen and can only be interpreted as the tip of an iceberg. And in summary, everything, really everything needs to be done to prevent the aggravation of climate change for the sake of future generations. Thank you very much for your attention. Thank you very much for listening. And I'm really looking forward to our discussion. Thanks.
Hello, thank you for inviting me to talk to you today. My name is Catriona Mellor and I'm a child and adolescent psychiatrist working in inpatient child and adolescent mental health services in the NHS in the UK. I've also been heavily involved in the Royal College of Psychiatrists' response to the climate and ecological emergency. And I've been asked to talk today about responding to the mental health effects of the climate crisis in children and young people. I'll be thinking about how to advocate for children and young people to support their mental health and well-being, and I think a major part of that is listening to them about how they're doing, what they want, and what will help. I'll cover the main impacts of the climate crisis on the mental health of children and young people, and I'll mention our recent Royal College of Psychiatrists position statement on the climate and ecological emergency. As well as direct and indirect effects of climate change, I'll mention the psychological responses to the overarching threats, for example, eco-distress. And at the end, I'll offer some examples of how we, as UK-based mental health care professionals, have been responding to this challenge, and share some ideas about maybe what we could do more broadly. So I'm a clinician, a parent, and a nature lover who's moved by the state we find ourselves in and the injustices of the situation to respond in the best way possible. This year, those of us in the UK may feel an added responsibility as hosts of the G7 summit in COP26. So I've chosen various strands of work, one of which has been to establish a group within the Royal College of Psychiatrists called EcoCAMS, CAMS standing for Child and Adolescent Mental Health Services. We are child and adolescent psychiatrists who are active in the region of nature, climate, and mental health. We have initially focused on raising awareness through writing, organising, conferences and training materials, trying to centre the young people voice by working with youth advocates and youth organisations, and also developing resources on eco-distress. So this is the context I'm speaking to you from. I'm UK-based and I'm a clinician, but not a researcher. And I won't be able to do justice to obviously all perspectives. One of the reasons Dr. Goldhagen reached out to the Royal College of Psychiatrists to be involved in this webinar series, I think, was the publication of this, our recent position statement on the climate and ecological emergency. It's a great starting point, particularly for a UK perspective. It makes well evidenced links between our mental health and that of the planet, and makes clear pledges for action that the college will lead on. There are some good infographics that I won't go into here, and I realise you can't necessarily see the details, but these can be seen on the Royal College of Psychiatrists website. I think these are quite helpful ways to show quite clearly the inextricable links between climate, nature, mental health, and sustainable psychiatric practices. And I'd just like to emphasise this nature element and make the case that our focus needs to be wider than just emissions in the climate crisis, and needs to also include the protection and restoration of biodiversity and ecosystems. So I'll talk about the climate and ecological emergency and eco-crisis at points throughout this talk, not just the climate crisis. I'm a strong believer that centering a nature-based perspective helps us see things more systemically, the problems and the solutions. One part of this for me is that regular access to healthy green and blue spaces for everyone is vital for health and well-being. I believe nature connection isn't a luxury, but should be seen as a right and as an issue of health equity. I think the systemic holistic view is really important. We need to communicate about how all these issues link together and are relevant to happy, healthy people. So that's rights and justice, physical and mental health, well-being and resilience, climate and nature, our health interventions themselves. Otherwise, we risk inadvertently making one aspect worse with our mitigation and adaptation attempts. The research into mental health impacts of climate change is of variable quality and is limited, especially in the area of children and young people. There's been very little research about the effects of pollution and loss of biodiversity. So the following conclusions are drawn from the evidence that is available in children and young people in the context of the climate crisis, some extrapolation from adult research, and some is based on mental health impacts of one-off natural disasters such as earthquakes or floods. Despite the limitations, and whilst acknowledging the need for more research, particularly in the most affected communities, there is more than enough evidence to see that there are very significant impacts on the mental health and well-being of our children and young people. For simplicity, we can split the psychological impacts of climate change into three main areas. There are the direct, acute impacts on mental health following extreme weather events, where we, for example, see an increased prevalence of anxiety, depression, and PTSD, and impact of hotter days and heat waves, which are associated with high psychiatric morbidity. There are the more gradual or indirect effects through the consequences of the climate crisis that affect social, economic, and environmental aspects of life and health. Like we've seen during the pandemic, the health impacts of climate change will fall most heavily on the most vulnerable. Children are one of those groups due to the psychological and physical needs of child and adolescent development, but not all children will be equally affected. The risk of mental health issues will be higher in those with pre-existing adversity, those in refugee populations, those living in the global south in locations most susceptible to the eco-crisis, but with weaker infrastructure. The tip of this pyramid refers to the emotional and psychological responses to that overarching existential threat. How do young people feel about the crisis, even if they have not experienced catastrophe directly? And words like eco-distress, eco-anxiety, climate grief, solastalgia are increasingly commonly being used. If we're talking about risk factors for developing mental health problems in the context of environmental triggers, the nature of the event is important, including its scale, and we know that long-term and accumulating events have more impact than one-off events. The child's experience of the disaster is important. For example, child proximity to the event, loss of family or friends, experiencing injury. And social factors have an impact, such as lack of parental support, lack of social support more generally, and socioeconomic status. Exposure of the child to violence at any stage, pre, during, or post an event, is a consistent risk factor for poor mental health outcomes. Really important, though, for us also to recognise children's resilience and insights and balance the narrative, making sure that we don't think of these mental health reactions as problems resting within the children. They are responding as we would expect to extremely difficult circumstances. We need to do research and promote conversations about individuals and communities that emerge from adversity with increased resilience, as the challenges perhaps give them new insights, opportunities to grow and develop, maybe clarity about what really matters to them. And when it comes to the children and young people's response to the existential threat of climate change, the eco-distress and related phenomena, we should acknowledge how adaptive this is. Their greater connection to the world and their emotions is helping us adults see things more clearly. They are acting as our canaries in the mind and giving us a better chance to prepare for the future. To go a bit more detail about the direct impacts of climate change, so there is the impact of an extreme weather event itself. This could be flood, hurricane, forest fire, and also the ensuing family stress, disruptions to social support networks and displacement that might occur. This can lead to increased prevalence of diagnosable mental health problems as listed here, and also other psychological effects have been documented. There is not much research on the impact of heat in children. Heat effects in adults include increased psychiatric morbidity and increased suicide rates. Data does suggest that there are more mental health crises in children and young people at extreme heats, and heat's been shown to have a significant impact on children's cognitive capacity and ability to learn. There can be these more gradual, indirect consequences of changes following from changes such as prolonged drought, sea level rise, land degradation, and changed growing season, which contribute to serious issues such as food insecurity, loss of land, increased urbanization, intergroup conflict, and flight and migration. These conditions threaten the social and economic determinants of children's mental health in various ways. And there's some specific examples on this slide. The climate crisis can directly or indirectly contribute to forced migration. And this may be globally one of the most important threats for mental health in children and adolescents. There are stresses at every stage which lead to an increased risk of PTSD, anxiety, depression, and emotional adjustment and behavioural disorders. Risk factors for developing mental health problems in this context include being an unaccompanied child or having traumatised parents. I'd like to now talk about the tip of that pyramid I showed you, the psychological responses to the overarching threat of climate crisis. From a UK perspective, where we are for now relatively protected from direct impacts, a lot of what young people are talking about is in this eco-distress realm. And so this has been one of the focuses of our work in EcoCAMS group. As part of our work, we drew up some guidance into a fact sheet, which is now available on the college website. And we decided to, after much discussion, call it eco-distress rather than eco-anxiety, in an attempt to not pathologise it and to represent a wide range of feelings elicited by these crises. The crisis is a complex one to face. It's enormous, beyond our individual control. We as a species have caused the issue and are not yet doing what is necessary to protect ourselves and our children. It makes sense, therefore, when young people describe this complex mix of changing feelings, which can include feeling angry, helpless, sad, panicky, outraged. Importantly, it's not an illness or diagnosis. These responses make sense in members of a species whose habitat and existence is threatened. We need to take note and respond to the threat that is causing the distress. The problem is the lack of action on the eco-crisis, and this is where the primary cure needs to be focused. However, whilst the eco-crisis remains and awareness grows, more and more children and young people will experience these often highly distressing experiences, and those of us in mental health care are well positioned to help. When it comes to supporting someone with eco-distress, it's not about curing it or making it go away. In some ways, it's support similar to that you may give when coming to terms with a chronic or terminal diagnosis. Lots of people, after being supported in this process, describe an increase in some elements of well-being, such as a greater sense of meaning, purpose, and motivation. Another term that's becoming more widely used is solastalgia, which describes a form of emotional distress caused by environmental change to a place you hold dear. Glenn Albrecht, who coined the term in 2005, describes it as the homesickness you have when you are still at home, but your home environment is changing in ways you find distressing. There's healthy debate around some of the terminology, particularly eco-anxiety, I think, which we may be able to go into later. Too much of a focus on eco-anxiety can certainly deflect from the more risky emotional response to the situation, which is ignoring or disengaging. So perhaps we should be instead thinking about labeling eco-indifference as a problem response. However we discuss people's emotional responses and the mental health impacts of the climate and ecological emergency, we need to prioritize curiosity, listening, and being open to different ways of knowing. That could be about how people define health and well-being, and the problems and the solutions. We need to try to resist the urge to overgeneralize and realize that individuals and communities hold their own answers. And the listening needs to end in action. Once we've heard what will help, we need to use our power and influence to help make that happen. We carried out a very small example of this listening with a small group of diverse young people from the UK to help inform the college position statement that I mentioned earlier. These young people spoke eloquently about their emotional responses to the loss around them, of species, possibilities in their own futures, on behalf of other peoples in the world. They showed a keen awareness of the injustice of climate change. Another quote was, "Kids in the global south don't have the mental health support systems, but are the ones actively experiencing it." They also said, "There are so many issues of environmental racism. If what was happening in equatorial countries was happening in countries where white people lived, there would be more of a response." There is a sense of this generation carrying a heavy burden and feeling let down by previous generations. They said things like, "When we think about the tipping points, we don't have a choice. I have to meet politicians to ask them to safeguard my future." They said, "There's a huge gap between where young people are coming from and where adults are. No matter how hard we try, people in positions to make a difference aren't listening. We're told all the time you need to listen, but this isn't reciprocated." They could also tell us clearly what we as the older generation could be doing to help them. They said we need to be heard, held in our grief, given a platform, and supported to take action. So just a little bit more detail about what they were asking from us. They said, "Please just do something about these emergencies." The message I heard is that our children and young people basically need us to be the adults in the room. They put it beautifully when they said to us they need us to understand the role of elders. When talking about how to be supported emotionally, they said, "Acknowledge that this is not just typical anxiety and depression. It feels different. Let young people know it's not being stupid or overreacting. Hold us in our grief for what we have lost and can't save. The earth is no longer sustaining us. This is a period for grieving. They said, we can be leaders. We hate it when people say we are the future. We are here now. They also asked us to help young people find the balance between active change, joining movements, and also stepping away from the constant barrage. So they need to be encouraged to have time to look after themselves, have fun, and enjoy time with their friends and family. And similar asks echo from across the world, I think, where young people are being moved to take things into their own hands, speaking up, expressing their pain and despair, demanding change. It's not right that young people are having to take to the streets and to the courts in order to be heard and responded to. But what huge insight, resilience, and bravery they are displaying. There are many important voices to listen to, and we must make sure we listen to those from the most affected communities. So, following on from all that, does this inform how we can develop a helpful response as mental health care practitioners? I think finding our own communities of support in which to share and reflect and focusing on our own health and well-being needs to be the starting point. Because if we do want to be the adults in the room, it isn't an easy set of tasks. We need to face our own emotional responses to the situation, be able to tolerate other people's distress, and embrace a certain amount of not knowing, a willingness to co-create solutions, probably making mistakes along the way. I think we can help with the messaging. This idea that healthy people need a healthy planet is an important one. Also helping people join the dots to see how issues of human rights and social justice are inextricably linked to this vision of health, so that any solutions tackle joint problems. We can contribute to urgent mitigation and adaptation efforts to cut carbon and rejuvenate the natural world, and show this needs to be an integral part of sustainable mental health care. And in response to the specific increase in demand for mental health care support, I think initially we need to raise awareness of the issues and ensure that the people who need to know start thinking about preparedness for this future and meaningfully invest in sustainable mental health care. There's a need to develop easily accessible, locally relevant interventions targeting specific groups. For example, fled children and adolescents. There's already considerable psychiatric and psychological expertise in the promotion of resilience, mental health responses to extreme weather events, and management of trauma-related conditions to be drawn upon. I think we also need to lead on promoting psychological adaptation. That is helping people come to terms with the situation and make the appropriate changes. And important work is being done to help people face difficult feelings in transformative ways. Examples include active hope and eco-psychological insights. There's also the extensive contribution from faith communities and Indigenous wisdom, recognising the spiritual and ethical dimensions of environmental challenges and the place of ceremony and prayer in meaningful human transformations. And finally, we need to support youth-led movements, whether that's school strikes, legal actions, or youth-led organisations like these amazing ones that are helping young people feel empowered to tackle the eco-crisis and to support each other's emotional well-being. In this way, maybe we can help address the intergenerational injustice present and hopefully start to bridge the feelings of disconnection. There are different ways to show solidarity, and maybe offering support to help young people protect against burnout is one useful way. But there will be other ways of promoting intergenerational dialogue and collaboration that hopefully we'll be able to discover together. Thank you.
So thank you so much to both of our speakers for those fabulous talks. And I noticed that we're getting a lot of questions in the chat, and I'd like to ask the speakers to address some of those questions. And the first one here is for Catriona. And it's this: is eco-indifference the result of ignorance about the climate crisis, or a response that children use to protect themselves from eco-anxiety?
Hi there. It's a good question. These are all, really new concepts and new terms, and lots of people have different ways of talking about them and structuring them. The way I see this is that when we're faced with overwhelming information, and that's basically what this is, isn't it? It's too big to get our heads around, and it brings up, it triggers everybody's fear and panic responses. And the question is then how do you as a person cope with that? And I think this is where some people will show that. I think a lot of people are having that experience. So they're being presented with the information and it causes an emotional response. And some people are more or less able to process that. Some people will show it as anxiety, some people will show it as anger, and some people, it's almost like they don't really like to get close to it at all. And as soon as that feeling emerges, then they just want to turn away, do anything to not have to deal with it. And so I think that's one of the ways that eco-indifference can come about. And of course, I think this is one of the major, this is a majorly important thing to help people manage this emotional response, because I think this is behind a lot of hopelessness and inaction and panic response and feeling powerless. And that I think something that we can offer in mental health professions is a little bit of insight into maybe some of the reasons behind this inaction as well.
Thank you, Catriona. The next question is for Dr. Weimann. And in a busy clinic practice, it can be difficult to carve out a few minutes to talk with a patient about climate change and health. And what advice do you have for finding the space for this conversation during the clinic hours? You might be muted, Dr. Weimann.
Sorry. Thank you very much for the questions, really relevant in our busy clinics. Over the last year, I really tried just to connect and find the connection to our climate crisis, especially also explaining diseases. And most often there is a link between the climate crisis or environmental degradation and the disease. And it's really useful just to point that out and to discuss it with a patient. And of course, there are patients that just ignore the whole drama around us, but still there are also some who find that very helpful if they just are given a space just to discuss it and to voice it. But I think it's an ongoing thing just to find. I think everybody needs to find their own steps in it. But I think just finding the connection and also having the interlinkedness between the climate and diseases, I think that's probably one of the first ones.
Thank you. Here's a question for Catriona. And this is, are there any courses for teachers so that teachers could help children with some of these mental issues that they face regarding the climate crisis?
Hi there, and I think someone's usefully put, is that right? Someone's put the Mental Health Foundation and Children's Health Scotland have just launched a resource. Thank you. I didn't know about that. We're kind of at that point now where there's so much being produced. So people in different parts of the world, I think, are seeing the need and are coming up with resources in all sorts of settings. So yes, teachers, also doctors. So we've got some resources for psychiatrists to use. That's also accessible for parents. And there are some common principles behind, how you can support young people. It's probably a little bit complex to go into now, but the principles are raising awareness among adults who have contact with children, so that when a child is feeling distressed and they turn to an adult, they're not faced by being dismissed or being told they're overreacting. And then it's having this idea of the balance between what some people call internal activism and external activism. So there's this idea that taking action can help reduce anxiety, particularly if it's targeted at the source of the anxiety, the crisis. And I think that is true to a certain extent, but there's a real risk of burnout if people take on too much responsibility for the problem, and if they're not doing this internal work as well, which is looking after themselves and learning how to not just move on and take action, but just process the situation and the emotions that are coming up for them. And there's lots of ways of helping young people look after their own well-being and develop a sort of emotional literacy around this climate. And of course, they are great support for each other. I think peer support and joining with other people is really, really important as well. There is, I'll just signpost, we've got a parent and patient leaflet on the Royal College of Psychiatrists website, which is kind of a starting point for some of these ideas, but there are lots of other organisations that are developing resources as well. Someone mentioned the Climate Psychiatry Alliance. There's also Climate Psychology Alliance as well, and we're trying to work together to sort of align some of our approaches to this.
Thank you. So our next question is for Dr. Weimann, and it is, how do doctors best mobilize to make our own voices heard about the health impacts of the climate crisis, especially now that we're coming up on 4 months until the big conference of parties in November in Scotland?
Yeah. Well, I think every country is a bit different. We here in Germany have founded Klug. That's an alliance of doctors here in Germany. And we are getting quite forceful. Now we have also developed a framework, for example, zero emission hospitals, and just have published it today. So I think it's also important to find your own peer groups, and also to find groups where you can locate to and interlink, and also find support. I think that's the mental crisis also affects us as health professionals. And for me, it's very important also to have other people I can talk to. And when I'm done, that I'm also able to just ventilate that. And having those supporting groups and doing different projects together also helps as well. And of course, there's an opportunity for COP, and I think Scotland and UK is very busy just also addressing the problem there.
Thank you. Our next question is for Dr. Mellor, and it is, what kind of advice do you give to parents of children who are showing eco-anxiety?
Thank you. I think the kind of principles are similar, aren't they? Whether you're a healthcare professional or a teacher or a parent. I think what parents often ask is about the age of their children, and what should we be saying to a 5-year-old who might have seen something, caught something on the news, or seen it, or even heard something at school, compared to what you might say to an 11-year-old, compared to what you might say to a 15-year-old. And of course, I don't think there's one answer that would cover that. I think, you have to know that every child is different and it depends on their age and what they've been exposed to. But again, there's a lot of conversation around this, there's some wonderful psychologists who are doing talks that are available online about speaking to young people, with the idea that from an early age you can talk to young people about feeling connected to the world and doing their bit to look after the garden or collect litter, without having to talk about concepts, global concepts that they would have no way of understanding. But then you can follow a child's lead and just using parents' instinct about how to be honest, and how to let your child know that you're a source of honest, clear, good information. But obviously, like we do with all sorts of issues that children come home with, using that filter to modify how much they have to cope with at any one time.
Thank you for that. Our next question is for Dr. Weimann, and it is, how can pediatricians ensure that coaches and others involved with children's sports are better prepared to handle heat emergencies?
Yeah, I've briefly just highlighted it. I think that's not very satisfactory at the moment, or what's happening, especially in pediatrics. There's a lot of, there's some interest about, adults and especially elderly, and also our minister here in Germany just mentioned it 2 days ago that they have a new web page for heat exposure and elderly people. And I think that's just not fair, because children are not in the focus and are definitely currently not the topic, and they are really vulnerable, even here in Germany. And if you've seen the example with the back seat of the car, I think that's not adequate. And we have to push as pediatricians just to get it right, and just to get it better voiced.
Thank you. The next question is for Dr. Mellor. Given that you are in the UK, we'd like to hear about how UK doctors are going to be active at the COP meeting. Many of us from other parts of the world will not be able to fly and will only hear about it in the news and read about it, but I imagine that some of you will be participating, and we'd like to hear what you have in mind for your participation.
I'll also comment on one of the comments, because as well as answering that question, if that's okay, Ruth, because Sarah says, I'm impressed that you say your college feels we should be supportive of school strikers, and I'm not sure they haven't gone to the point of actually making a public statement like that. So the list of ideas at the end was me speaking as a member of the Royal College of Psychiatrists. But I have to say, the child and adolescent faculty within the college has very much been, vocal on this, and there are lots of members who do support the school strikes, and young people featured heavily in the college statement, and there was mention there about the sort of motivation and drive that young people are showing, and the way they're leading the way. So they've maybe not been quite as direct as I might have implied, but there's certainly a lot of people within the college who do that. And as regards how doctors are going to be active around COP26, we're willing to receive any suggestions. So we can act on behalf of doctors from all over the world. So do let us know. As you can imagine, there's I think there's a healthy number of healthcare professionals active in the UK at different levels. So some people are working within the college structures, and we've got observer status, for example, in the Royal College of Psychiatrists at COP26, I think. We've put in various applications for sort of symposiums and displays at COP26 itself. I'm sure there's a healthy activist population within the UK, and I don't think they will disappoint either. So I hope there'll be a sort of combine, I think it's about trying to use as many different ways to communicate with as many different groups as possible. And so I hope that's what we'll be able to do.
Thank you. The next question is for Dr. Weimann, and this is, you've mentioned that children from the global south will be potentially the more affected than children from the north. And the question is, how do we encourage more voices from children who are most affected, a diverser group of voices of children?
Well, I think just also organizations and societies like our one ISSOP, I think it's an ideal platform to also voice the other voices from the global south. And also when we are just coming together and having partnerships and doing partnerships, that we just interlink everything with each other. And that also is definitely true for climate change related diseases and environmental related diseases. And well, as I do have that connection to Cape Town, it's for me it's quite normal that the voices from the global south are also heard. But I think it also needs to be more implemented in the north, yeah, that those voices are heard there as well and also respected.
Thank you. And the question for Dr. Mellor, many of us would like to partner with youth groups, but it's not so easy sometimes to find the groups of youth and to develop these partnerships. And we wondered if you had any tips for us about identifying the youth groups and then establishing collaboration with them.
It is really difficult, isn't it? And I think it's got to be done in a way that there's going to be a clear benefit for the youth group, I think. We're still waiting to hear around one of the proposals we've put in for COP26. So I don't know what that means, whether it has or hasn't been accepted, but and I'm just mentioning that because in order to do that, we've joined together with some youth organizations specifically around this, and we did that through networks of I think it's just because we work with young people, young activists, and then actually I'm linked to people within the Climate Psychiatry Alliance and Climate Psychology Alliance who are working with young people organizations. And so they were able to do that introduction, and were able to say to the young people, this would be the benefit, if you join this would be the benefit to you. It's got to be kind of mutually beneficial, but it's not easy. And actually then, that's a reasonably new thing that we're doing, and it brings up issues around safeguarding and confidentiality and all sorts of things that we're sort of working our way through. And I would say also trying to get a diverse representation of groups, like the previous question you asked, Edda, was, I think that's difficult as well, because obviously as we reach out as UK doctors, we're going to first of all find other people with the same sort of perspective as us. So it is this ongoing challenge. But we've found, if you've got a good idea and you can offer something that's helpful, actually the energy is amazing. You can reach out and say, would you like to collaborate? And it's been a really fruitful and rewarding piece of work, actually, which there's been some teething problems and we haven't got it right all the time. I think that's one of the things I said, got to be prepared to sort of not get it right all the time. But we're, trying to be a bit humble about that and work our way through it. So advice, I think it's just about reaching out and saying why this would be good for them, and maybe asking 10 people and expecting just one to reply.
Well, thank you. Well, what I'd like to do is wrap up the Q&A now. And we've got breakout rooms coming. And I'd like to ask Miguel to give us instructions about how to join the breakout groups. Miguel, are you with us?
I am. Thank you, Dr. Etzel. So I'm going to share a quick slide with instructions on how to, are you able to see that slide?
Yes,
Okay, so the breakout rooms are now open. And you should be able to click on that button and join the room of your choice.